Getting the COVID-19 booster is about doing our part to love and protect our families. Vaccines are a life-saving tool in the fight against the virus. Over time, they become less effective at preventing serious illness, just like other vaccines. We need the boosters to increase protection against COVID-19 and its variants, ultimately preventing us from getting really sick or dying. So do it for your family, especially those at higher risk. Protect the ones you love. Vaccinate.
Good afternoon. I am Letitia Stein, the Inquirer's health editor. Thank you for joining us today for an Inquirer Live health report presented by Independence Blue Cross. As we are feeling our first winter weather here in Philadelphia this week, there are still many unanswered questions about how COVID-19 may spread during the traditional cold weather sick season. A vast majority of Americans are now vaccinated, but far fewer have had their booster shots. The current levels of vaccination and immunity from COVID infections should protect many people from getting so sick that they have to be hospitalized, but new variants circulating may well evade some of our existing immune protections. And now many doctors around Philadelphia and beyond are worried about what some are calling a triple-demic, cases of flu, RSV, and COVID-19 creating a tsunami of sickness at the same time. I'm joined today by Dr. Stephen Gluckman, an infectious disease specialist who directs the Penn Global Medicine Program, and Inquirer health reporter Jason Laughlin, who has covered COVID throughout the pandemic for us. In the next half hour, we will be discussing what to expect from COVID in the coming months, how Philadelphia will be tracking the virus, and what you should know about the surge in other seasonal colds and respiratory illnesses as we head into these cold weather months. Thank you for joining me, Jason and Dr. Gluckman. Let's start with the big unknown, Dr. Gluckman. What should we expect from COVID this winter?
Well, I first of all agree with the big unknown part. And much of that is a function of what the new variants will be and how well we'll be protected from them. But it's not as if we have no data. The city keeps track of numbers and national numbers. What we've seen with COVID, and we keep track of the numbers in our own institution weekly. What we've seen with COVID is that the diagnoses have been pretty much flat for the last month at around 300, more or less. And so if there's no change in the virus itself, I think it's reasonable to assume it isn't going to get much, the COVID component of this triple threat isn't going to get much worse. Reasonable to assume. On the other hand, just looking at the numbers again, the RSV and flu are shooting up. And we can talk more about that. But at least the little limited data we have now is maybe COVID will be manageable. And I would even maybe venture to say probably. There are a lot more people protected now than there were. And I think that's probably the main reason.
Yeah. Maybe, Jason, we can talk for a moment about tracking and then come back to what we're seeing in the numbers with you Dr. Gluckman. Jason, can you share just how health officials will be tracking these COVID cases this winter? And tracking has been an issue from the start. Is it different now at this point in the pandemic as well?
It is a little different. I'm going to post in the comments the Philadelphia tracking system, if I can figure out how to do that. But in the meantime, what is different this year is Philadelphia has implemented a wastewater testing program. It's, as we know, as long as home testing has become more common, that makes the public testing data less reliable as a tracker of how COVID is spreading. And wastewater, which is sampling exactly what it sounds like, sewage, to find the presence of COVID. It's not going to provide necessarily specific case counts, but it is going to give a very good idea of trends in the city. Whether there's more COVID, there's less COVID. If you look at the data right now, it's more or less stable, which matches what the doctor just said. But the idea is that wastewater will be able to pick up a surge possibly earlier than any other means we have. They'll also, as they have throughout the pandemic, be using hospitalizations and severe hospitalizations in ICUs to determine how serious the virus is in Philadelphia this winter.
And as Dr. Gluckman, as you were saying, part of the surge we're seeing right now, it's not specifically COVID. You brought some charts to our discussion today that illustrate this point. Perhaps we can bring them on the screen and
Sure.
you can elaborate a little bit more on what we're seeing right now across the board.
I don't have access to a pointer, but I think I can just describe it. So these are national numbers, and what they're reflecting is reporting of respiratory illnesses in general. And this year is the purple one, far to the left on the graph. And what you can see is, first of all, it's shooting up, and second of all, it's occurring much earlier. Each line is a different year. I should have said that. It's occurring considerably earlier this year than in the last 5 years. So we're already seeing a real uptick in numbers in our lab, where we get the weekly numbers. As I said, the COVID numbers have been flatlined at around 300 for our institution. On the other hand, in the last 4 weeks, flu has gone from 17 to 170. So it's increased by a full log. And RSV has gone from 49 to 118. So in just the last 4 weeks, and again, where COVID has stayed flat. So it is absolutely shooting up. And I'm this is a cop out. I don't take care of kids, but from the RSV point of view, it's an annoying disease in adults, but rarely a problem. And flu, we have ways of at least potentially preventing it, i.e., the vaccine. So if one is an optimist, one might say that this is going up fast, but it's not going to be sustained, and it will drop. I can't say the same about kids, though. I think it's a much bigger, RSV is a way bigger problem in the pediatric population.
That's very interesting. And this graph is striking. Just to reiterate, as I think you were saying, this very far left line that is spiking, that is where we are thus far this year. And of course, we don't completely know what will come next. But Dr. Gluckman, what are you advising patients about the COVID vaccine, boosters, and other protective measures that they could be taking at this point in time in the year?
Well, first of all, they should get vaccinated. I think there's a lot of misunderstandings about the vaccine, and much of it through nobody's fault. But things were changing so rapidly that the recommendations changed rapidly, and it gave some people the impression that the people making these recommendations were a little confused or didn't know what they were talking about. A lot of that was driven by just how rapidly things were changing, and our information was changing. The COVID vaccine is a superb vaccine. It's one of the best we have. The perhaps overemphasized have been the breakthroughs. Yeah, if you get vaccinated, you might yet get COVID, but the breakthroughs are very, very rarely serious, requiring hospitalizations or relating to deaths. Look, the flu vaccine, there are breakthroughs. We should all get the flu vaccine, but some people get flu even though they've been vaccinated. In fact, the COVID vaccine is much more effective than the flu vaccine. So it's a really effective vaccine with the understanding, yeah, you can have a breakthrough, and nobody likes to be sick for 4 or 5 days or a week, but you're not going to die of it. So it's really important to get vaccinated, and that does have implications for people around you. If you don't get COVID, then you won't give it to people around you. So that's a critical thing. The others are a little more complicated. The other recommendations. One of the problems with COVID is it's here to stay, and it'd be different if we knew, well, it's going to disappear in X number of months. It ain't It's not disappearing. So we have to somewhat adjust to the fact that we are living in the COVID era and will for the foreseeable future. So what does that mean? It means I don't wear a mask everywhere anymore, by the way, other than at work where I'm required to and probably should. But I don't wear a mask if I go out to a restaurant, but I sure as heck could wear a mask if I was going to a crowded theater. I wear a mask in airports and on planes. But I'm being a little selective, and people have varying degrees of angst about COVID, and I'm not critical if somebody wants to wear a mask more, nor for that matter if they want to wear it less. But they should be vaccinated. At least they will modify the disease if they get it. All this to do about side effects, whatever side effect you pick is worse if you get COVID. This issue with the vaccine causing heart issues. If you get COVID, your risk of getting a heart problem is 100 times worse than from the vaccine. There's no comparison. And that's unfortunately a lot of misunderstanding. And, I have to say it's some politicizing of the vaccine.
Thank you. Thank you for sharing that. On the topic of vaccines, Jason, perhaps we could talk a little bit about this year's booster shot. It was developed differently than the initial vaccines. Can you just explain what is this year's booster shot and what is it designed to protect against?
Yeah, the most current booster is supposed to be attenuated specifically to Omicron strains and be more effective at preventing infections from Omicron strains, which are the kinds of the COVID variations that are spreading right now. How effective it actually is, it seems a little up for debate. There are signs that it is effective. There's also signs that maybe it's not that effective. I think as a non-scientist, and Dr. Gluckman may have a better idea of this than I do, but it just seems to me that it's a little uncertain right now. There's not enough evidence in how effective it is. We were talking about this before the event started. We talked to Paul Offit very recently, who is another vaccine expert in Philadelphia. He's with CHOP. And he has been sort of dismissive of this particular bivalent vaccine. But and to what Dr. Gluckman was saying, I think you would largely agree. He also says get vaccinated. The benefits of booster after booster, he's not as certain about that, but the first 2 shots and a booster, absolutely enormously valuable, turns COVID from something that could be life-threatening to a much less serious illness. His discussion is more about the effectiveness of this particular kind of booster. He is not convinced there's much value unless you are an older person, and the lineup that he gave was 75 or older. Maybe you should get this as a booster shot. People with immune compromised conditions, people with health conditions, but for the average person, they may not need it. According to him, and that is not the only opinion out there. But Dr. Gluckman, if you want to,
I totally agree with that. It's a matter of whether you think it's worth the putting in the whole infrastructure and the expense. Yeah, I think his 2 arguments are totally legit. He is a world's expert. One is we don't have quite as much information about how protective it is. And the other is it looks like its benefit is relatively small beyond having had the other boosters. And so then the question is what's the downside? Is it worth the expense to have this in place? And, my perspective is why not? If somebody's offering this vaccine, why not? And I agree with you. If you're particularly at risk for having more severe disease, then that why not becomes you should. But I don't see a particular downside to it. So I suggest it.
I would add too, as part of my discussions with Dr. Offit, and you mentioned this yourself. He brought up breakthrough cases.
Yeah,
you did, and he sort of said, he wished that term hadn't caught on.
Right.
He said, because it sort of implies something's gone wrong with the vaccine or it's not doing its job. And he said, if you are getting mildly ill, but you're not getting seriously ill, you're not getting hospitalized, this worked great. This is
It's
doing
a
what you do.
successful vaccine. It's a great vaccine. And I think the public doesn't really understand that.
Mm-hmm.
It really is a really good vaccine. Keeps you from dying, keeps you out of the hospital, you know?
And one of the things that I think it sounds like everyone's in agreement on is that science is a process of often, debate, evidence, testing the evidence, further refining the evidence, and being able to have these conversations publicly, is part of the scientific method. So we appreciate that perspective. I might, for those who are with us, I might just take a moment to remind people that if you have questions or comments, please submit them in the comment section. If you're watching us on social media, you can share comments on Inquirer Live. I'm sorry, it's inquirer.com/live. And we will see after we talk a little bit further if we're able to get to some questions today as well. Maybe switching gears just a bit, Dr. Gluckman, as we now know after 3 years of living with COVID, it seems there's always a new variant on the horizon. And the most quote unquote successful of them will be more effective at evading what immune protections we have built thus far. How much does this concern you? And what do you anticipate when it comes to the further evolution of the next variant of this virus?
Well, it does concern all of us that there are many variants that are happening. The only ones that make sort of the general public info are the ones that are causing problems. There are many variants that are happening regularly. It's the nature of the way this virus reproduces itself. Fortunately, most of those are either non-contagious or minimally so, or not very pathogenic. They don't cause a lot of disease. But they're regularly occurring, and the legit fear is that there will still be more down the road that will be more contagious and or more capable of causing severe disease. It almost predicts it will happen, and I think the trick in quotes is trying to keep our immunizations current enough that they can deal with these new variants as they appear. That's the nature of this the new vaccine is a duovalent vaccine. It's effective against the two most common circulating strains now, B4 and B5, and that was deliberately designed that way. So the way to go forward, at least for the moment, is to keep track of what's circulating and try to design vaccines that will match what's circulating.
Yeah.
But there are variants all the time. The issue is when it will be a bad one.
Yeah. Jason, you are following the numbers very closely still for us. Do we see any indication that hospitals are facing the overcrowding or the burden that they've experienced in the past? And then after perhaps you share with us what the present day situation is, Dr. Gluckman, maybe you could share any thoughts you have on what hospitals might anticipate this winter.
Yeah, it certainly doesn't look like it right now. We do every week look at where the COVID numbers are. We look at cases, we look at hospitalizations, and there are percent increases or decreases, but the numbers generally are so low that a big percent increase. I think the most recent increase in Philadelphia was something like a 15% increase in hospitalizations, but the raw number is small. And that seems to be the case for quite a while now. So as of right now, I've not heard any information that hospitals are concerned about overcrowding in the immediate future.
Yeah, I haven't either.
Right. And obviously, where we are seeing hospital overcrowding that we've been covered, and Jason, if you have anything further to add on this, is specifically children's hospitals, which are dealing with these respiratory illnesses and specifically RSV. It's not COVID, but it does seem like it's quite a burden on the children's hospitals right now. Jason, Can you share anything more about that?
Yeah, my colleague Wendy Ruderman wrote about this very recently, just yesterday, and the waits in children's hospitals are enormous. I think at St. Christopher, she said there could be up to a 6-hour wait for children to get treated, that the cases are so significant elsewhere that people are being transferred to Philadelphia because their local hospitals don't have the capacity to treat them. So that really is a significant burden. I found a study that ran in JAMA actually last year, December 2021, that predicted this, that said that 2021, 2022 were going to be bad for RSV. What's positive is that same study anticipated that 2023 we would even out and return to more normal levels. But one of the factors at work seems to be because of everybody socially distancing, wearing masks, very young children maybe weren't exposed to some of the same viruses that they would have been normally. So everything is sort of piled on now because we are sort of returning to a normal lifestyle. So it's almost kind of making up for lost time.
Yeah, that makes sense. I remember someone telling me when my daughter was young and going into daycare that I could sort of choose when we might get sick, right? If I put her in daycare when she was young, we'd get sick right away. If I waited until she went to school, she'd be sick in kindergarten. So perhaps we are dealing with almost a COVID era version of some of this. I'd like, unless there's anything further you would say on this, Dr. Gluckman, I'd like to maybe turn to, we have a couple of interesting questions that have come in from the people who are with us.
Sure.
One is related to testing. So what is the current advice for COVID rapid testing? Should we test for all sniffles, wait for fever? What are the first symptoms that we are currently seeing? Dr. Gluckman, could you answer this?
Sure. And it is a little confusing, quite honestly. COVID can have many manifestations, including being completely asymptomatic to having a rather mild illness with sniffles. I think the general wisdom is to have a very low threshold for testing with symptoms. The only time I would recommend testing in people who have no symptoms if there's a particular social issue that's relevant, but otherwise no. One needs to remember that the testing has all tests, including this one, have limitations, and particularly if you have no symptoms. If you have no symptoms, the sensitivity of the test is actually not very good. If you have symptoms, the sensitivity goes up to reasonable levels, but I'm sure people that are listening know somebody who tested and was negative, and they tested the next day and it was positive. So you have to be a little skeptical about a negative test in the presence of symptoms, and I probably would repeat it. On the other hand, if it's positive, it's real. The positive testing is very specific, sensitive, I should say, and specific. Other things that one needs to think about with testing. The test, if you have COVID, the test can stay positive for many weeks. That doesn't represent active infectious virus. That represents pieces of dead virus. And so in general, if somebody is tested positive, they have COVID, they're clinically improving, we don't recommend retesting, because it's just going to be, they're going to stay positive for 2 weeks, and somebody's going to, for want of a better medical term, freak out. They don't need to test. If they're getting better, the fact that they stay positive is not relevant. It doesn't represent contagious virus, and it's just going to confuse life.
How long would you say people should kind of seclude themselves after a positive test?
Yeah, well, I can tell you what the CDC says. That's easy. And I think it's probably legit. If you test positive, you should isolate for 5 days, and you can then come out of isolation, but conscientiously wear a mask for another 5 days. But the discontinuation of the mask, again, caveat, in somebody who is clinically improved, should not be related to whether you still test positive. Okay, you may test positive for weeks.
Yeah, thank you. I think we have another question for the time that we have remaining, so let me share that, and grateful for your help answering this one as well. What are the recommended distances to stay away from people to avoid transmission of the flu and COVID viruses? Indoors, outdoors, perhaps this also might be an opportunity to further elaborate on some of the choices and decisions that you mentioned you were personally making around masking at this point in time.
Sure. Well, the recommended distances have been, 6 feet or so. It's not an absolute. And nobody goes around measuring, of course. I don't know that anybody's suggested that should be different if it's indoors or outdoors. If there's a difference indoors and outdoors, it has to do with ventilation, but not necessarily distance. So that would be, if somebody wants to be careful about distancing, I would say, think about 6 feet. Again, now that we're living in a COVID era, I think many of us are not necessarily adhering to that. I don't, by the way. It's not, I mean, you can, but that means you're really limiting what you can do, particularly now that it's cold out. But I do still avoid crowds or wear a mask in crowds. I always have a mask with me, always. But I don't wear the mask walking along the street anymore. I wouldn't go to a crowded restaurant, but I go to restaurants. So some of it is people just having to develop some degree of comfort with the fact we're living with this and we'll continue to live with this. And there's no way around it. Get vaccinated. Can't overemphasize how important that is. You may get COVID, but you're not going to get seriously ill.
Thank you. As we are wrapping up, is there any other advice from the public health community that you would share? But it seems as though this is, at this point, some of these refrains we've been hearing for quite some time, and they're not changing, probably because they work, right?
Yeah, they do work. And again, the emphasis, not the emphasis, but the commenting on the risks of these vaccines, I think, have also sort of distorted reality. They're very, very safe vaccines. And by the way, we get vaccinated, I also need flu, of course. And I remind people break through the flu vaccine. Occasionally people get hospitalized from flu. It isn't different, really, anymore. And flu also changes its antigenic coat. So we have to adapt to that on a regular basis so that our vaccine matches the flu that's floating around. One of the hopefully better things about flu is the typical flu epidemic is a rather steep upslope and a rather steep downslope. It doesn't stick around for months, or like in COVID's cases, years. It's a winter disease, and it typically lasts the bulk of it is 6 to 8 weeks. By the way, since we're right now in already a marked upslope, it's almost too late to get vaccinated. I wouldn't not get vaccinated, but the vaccine to be fully protective takes up as long as 2 weeks. So people who haven't been vaccinated should get it like now, or they're going to be too late.
This is all very pertinent to be keeping in mind as we're moving into a time of year when we will be having holiday gatherings and travel, as well as the cold weather. So thank you very much for these thoughts and the guidance and the perspective, Jason, that you've been able to offer too from your coverage. So I appreciate those who are with us. Thank you for joining us for the Inquirer Live Health Report presented by Independence Blue Cross. We look forward to seeing you hopefully next time. And to read more about COVID coverage, please visit the inquirer.com/health. For Jason and Dr. Laughlin, I am Letitia Stein with the Philadelphia Inquirer, and please have a good evening.